More than 142 million Americans have gotten their first dose of the COVID vaccine. That's more than 54% of the adult population. But the concerning trend now is demand for vaccines is dropping across the country, and thousands of doses are set to expire this afternoon. So joining me now for more on the race to vaccinate is epidemiologist and ABC News contributor, Dr. John Brownstein. Doctor, good morning. Thanks for joining us. There was always this concern that the demand drop was looming around the corner. Why are we seeing it happen now? And how do we get to herd immunity if interest in the vaccine continues to fade even further?
Yeah, Trevor, this is a really important issue that is evolving. We knew it was going to happen. We didn't think maybe it was going to happen this soon. You mentioned 142 million Americans have been vaccinated. That's amazing. But we have over 100 million that have yet to be vaccinated. And we've gone from this sort of desperate search for vaccine to now trying to sway the public to get immunized. We had this first wave with the older population that was really, on board with the vaccine. Now we have the younger population that is not necessarily on board. They may be hesitant because they're not interested in the side effects. They want to wait and see. They may not trust the vaccine or may just not see it as valuable for themselves. So we have to be pushing policy decisions that sort of open up supply, make it as easy as possible for people to get the vaccine. That is, of course, using pharmacies and pop-ups and mobile clinics. We know that 90% of Americans are within 5 miles of a site, but that's not always the best kind of site for everyone. And we've seen these innovative strategies like paying people or maybe giving free beers or shots. Whatever it takes, I guess. But then when you look at what's happening in India with the massive increase, we should be so thankful for this vaccine. So we need to educate the public of why it's so important and why getting us all on board with the vaccine ultimately gets us to that herd immunity number.
So we have those concerns with getting people to get the shot at all. But beyond that, we know that you just wrote a paper that came out today about Americans, many of them who have already received a first dose of the vaccine, confused about the timing and the protection, the necessity of that second dose. So can you clarify for us, how important is it to get that second dose, and how important is it to get it in the set timing window that's recommended?
Yeah, this is a good question. And unfortunately, what we found is that millions of people are not getting that second dose in the recommended time. There's a lot of reasons for that, challenges of getting that second appointment, or maybe they're afraid of the side effects because they had some of the side effects from the first dose. But we're also finding out that there's an education issue. People don't actually fully understand when they're protected. You need that 2-dose regime. You need to wait 1 to 2 weeks. There's a lot of confusion. And so we need to educate people on why it's so important to get that second dose, because that fully gives you that protection that we saw in the clinical trials. And yes, I think there's this real challenge of getting everyone to think about the importance of a 2-dose strategy. I think that, ultimately that's what we need to get to that herd immunity number. I think that, again, it's about getting everyone on board and fully explaining, what the clinical trial showed and not allowing people to miss that second dose.
We don't want to discount the positive progress that we've made in a lot of areas. We're starting to see some of these returns to normal life. But with that, for example, schools returning, the Kansas City Star is reporting doctors there saying more parents are refusing to have their sick children tested for coronavirus because they don't want to deal with the hassle if the results are positive. What's your message to parents who might suspect that their kids have COVID?
Yeah, this is so tricky because, of course, we want to stop with all the interventions. Obviously, we want to get the masks off. We want to stop with testing. But the message really is to hang on a little bit longer. We have 60,000 cases a day still in this country. We have active transmission in places like Oregon and Washington and Michigan. The situation improves. We will see the data get better, and over time, we'll get to stop with the testing. But for now, it's important to identify people who are infected. We know that the younger population is what is driving infection in the community. And we know that, children represent 30% of reported cases. You do not want to be sending your child back into school infected. We know there are plenty of vulnerable kids out there that can deal with the worst of this virus. That would be unfair, and in fact would put the whole school in jeopardy of closing. And so this is all about trying to protect yourself, but also the community to get to that point. Now, we will get to a point where we can stop with the testing, but I think we're a few months away from that.
I don't want to necessarily use the term silver lining, but I think a sentiment a lot of people have shared is this has been a terrible pandemic. It could have been even worse if this virus was deadlier for children. Having said that, we just saw Kana's piece about the future of vaccinating children. How vital is it for children to get vaccinated for us to be able to move past this pandemic?
We keep talking about herd immunity, and that number could be about 80%. It might be more based on variants. And so with children making up 20% of the population, you have this important segment that needs to get vaccinated. We know that we're not going to get to 80% just on adults alone. We just discussed hesitancy issue or people not wanting to get the vaccine. There are plenty of adults that can't get the vaccine for a variety of reasons or may not mount an effective immune response because of an underlying condition. So we need kids to get on board with the vaccine. It's not necessarily because they're at higher risk, but it's because it will drive down transmission in the community. I do think we're going to see the 12 and over getting vaccinated later this summer, younger kids into 2022. And that means that these vaccinated kids will also get to enjoy all the benefits of all these CDC guidelines for those that are vaccinated as well.
Summertime vaccinations for above 12, that would be a huge development. Of course, a lot of that is contingent on these trials that are happening right now with both Pfizer and Moderna. What's your advice to parents whose children maybe could be part of those vaccine trials? And really just in general, what do parents need to know about the vaccines as we get into the summer or into 2022 and they hopefully become available to children?
As we've been saying throughout the pandemic, these clinical trials are the key, right? Because they provide us important data of efficacy, but also safety. So parents that are volunteering their kids into these trials, they're heroes. The parents are heroes, the kids are heroes because they're giving us that critical data on safety and efficacy. The full expectation is that these vaccines will be incredibly safe. We've already given out 1 billion doses of vaccine across the globe. The safety looks incredible, but we'll get more data. And as we get that data in kids, we'll be able to evaluate it. And then, the FDA will make a decision on whether they can expand the EUA to include kids. I fully expect that to happen. I think the recommendation will be to expand to kids. And, we'll start to see this, kids getting vaccinated. I think hopefully parents will get on board with this because they'll recognize that it's about keeping their kids safe, but it's also about bringing down transmission in the community and finally being at the other end of this pandemic.
Hopefully we can keep that demand up in at least that category. Dr. John Brownstein, thank you and appreciate your time.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.